Hi folks, this is Dr. Rob CYWES. I am the Carb Addiction Doc. And today I'm going to raise a red flag and create a little bit of an alert for those of you that have adopted a ketogenic way of life and are using some supplements and are really happy with your way of life. And the title of today's video, and it's so important to understand this, is that too much of a good thing can actually be a bad thing. Now, there's two parts to this video. There's the macros and the micros. So the first thing I want to talk about is that it's very common and I think very appropriate for people that come from the standard American diet, which is overloaded with carbohydrates and underloaded with micronutrients, to correct that micronutrient deficiency. So it's perfectly legitimate for people to take minerals and vitamins and trace elements in slightly higher quantities than normal to replenish stores. Your vitamin B levels, your ADEKs. Vitamin C is not really replenishable. It's something that should be consumed on a regular basis. The body doesn't store it very well. But replenishing your sodium levels, your magnesium levels, replenishing all of those levels is very important when you're converting from a standard American diet across to a ketogenic or a proper human diet, as my good buddy Ken Berry speaks about. And so, yes, it is appropriate early on. I believe that the best strategy is to adopt an ultra low carbohydrate, high fat, protein based diet from the macro perspective and get your micronutrients from whole foods, from eggs, from cheese, dairy, from liver, from oysters, from sardines, from whole animals, but also to supplement with minerals, vitamins, and trace elements, particularly salt. Salt should be ubiquitous. It's actually not a supplement. Salt should just be a condiment. But supplementing with sodium, with chloride, with iodine in your salt, and also electrolytes in that salt, perfectly fine. But what I notice in my practice is that as people self-correct, as they build up those levels, for some, well, not for some reason, for a misappropriate reason, there are many flapping gums on the internet that assign magical, mystical properties to massive doses of minerals and vitamins and trace elements. So, for example, there is a gimmick weight loss. Oh, B12 shots. Come in and get your B12 shots. Come in and get your B12 shots. And yes, when you replenish B12 levels, your appetite suppresses, you lose a little bit of weight. But there are, I would call them, unethical practices out there that use B12 shots as a weight loss tool. Be very careful. Don't be a victim of that bullshit. So people are taking mega doses of magnesium. They're taking mega doses of 3-omega fatty acids. They're taking mega doses of B vitamins, of folate, of whatever it is. And they never, ever, ever measure their levels. There's a ton of good minerals and vitamins in food. That's why we survive as a human. I can tell you, I come from Africa. Behind the third bush on the left is not a GNC that's selling bottles of minerals and vitamins. The right place to get our minerals and vitamins is from our food. The appropriate reason to supplement for most people is to replenish that and then slowly back off. But the internet promises us magic if we take mega doses. And those mega doses can be very harmful. So make sure your doctor, and we do this all the time, measures those levels. The numbers of times that I see people coming in, well, we've got a problem here with your red blood cell size and shape. And you look at their B12 levels, which should be, in my opinion, between 600 and 800 to be healthy. They're greater than 2,000, unmeasurable. Well, when that pendulum swings that far across with B12, the body doesn't just magically say, ha, ha, ha. Those micronutrients can be toxic to the human body. Too much iron is a bad thing. Too much copper is a bad thing. Too much magnesium, folks, is a bad thing. And if you don't know what your number is, and if your doctor is not checking your red blood cell magnesium, you have a problem if you're just popping those pills. Please, please, please make sure you understand. Oh, mega quantities of zinc. Well, I've seen zinc toxicity. I've seen iron toxicity. I've seen folate toxicity. I've seen B12 toxicity. I've seen vitamin D levels that were unmeasurably high. I was going to use the F-bomb there. Nah, I won't do that. Bullshit is the highest I get in terms of my bad words. But mega doses of vitamin D messes with your system. But you believe, I'm deficient. Be very, very careful with mega doses of micronutrients. 3 to 5 grams of salt is appropriate. The salt curve does this. Too little salt, really bad. Yes, cardiologists, yes, world out there, too little salt is one of the most harmful micronutrient deficiencies that America is suffering from. Too little salt and too much sugar. However, mega doses of salt cause damage. Mega doses of salt cause damage. You may not see that in your blood sodium because blood sodium levels are always 140, but they cause damage to the intestine, they cause damage to your cells. Be very careful with that. And if you see your chloride levels very high, sodium chloride levels are high, but sodium levels are good, that may be a problem with salt consumption. It may also be a pH or an electrolyte problem within the blood. Mega doses are harmful. So please make sure you measure those. And when the doctor says, dude, you're overdoing this, figure out what you're going to do to back off. Because more is not always better. So that's the micronutrient side. Now we're going to flip across to the macronutrient side. And this is something that is very difficult for people in the ketogenic space, for rookies and for gum flappers on the internet to really understand. But it's something that a few of us are starting to see more and more in practice. And I've got a whole video coming out about this. In fact, I've had a few coming out already, but it's going to be a very, very important subject. For those of us that have been following a ketogenic diet, particularly more on the carnivore side, which is brilliant. I love this. I love being on a carnivore diet. I'm on it myself. My son is being raised on one. He's 14 months old. So I like the carnivore diet, but the carnivore diet, the low-carb, high-fat diet, is specific and exclusively there to correct insulin sensitivity. To correct insulin resistance and restore insulin sensitivity. So insulin resistance is when you're not eating enough fat and you're eating too much carbohydrate and your body is resistant to mega doses of insulin. And the way we restore that is to get the cells of your body to stop preferring and being forced to use sugar as a fuel source because it's in excess, and helping the body, the cells of the body that can, to preferentially use fat and ketones to fat adapt. So that they're using fat as a fuel source, and slowly your blood sugar comes down and the cells open up the front door, dephosphorylate the insulin receptor, become insulin sensitive, so that sugar flux between the bloodstream and your intracellular blood sugar is fairly level, and that smaller and smaller and smaller amounts of insulin do the job of getting sugar in. Now, here's what most people don't understand, is there are two aspects to insulin sensitivity. The first aspect is that for cells that require sugar, that a small amount of insulin is able to get huge amounts of sugar into those cells, or appropriate amounts of sugar into those cells very easily at a very low insulin dose. And that's appropriate. That's exactly what we want. However, the other problem with insulin sensitivity is that if we use a low-carb, high-fat diet, we have to use that fat because we're not storing it. We're not getting fatter. We have to use that fat. So the cells preferentially use fat, and they actually don't even use sugar. And if there's no demand by your cells, or very little demand by the cells that can use fat and sugar equally, for that extra sugar burst, they don't need insulin. So your insulin levels, even around the time of meals when you're not eating sugar, remain super low. And folks, that's a problem. That's a problem. Because insulin is a crucial hormone, not just for energy dynamics, but insulin controls cholesterol function. Insulin controls every single hormonal pathway, whether it's cortisol, whether it's adrenaline, whether it's growth hormone, whether it's thyroid hormone, whether it's steroid hormone production, testosterone, progesterone, estrogen. Insulin controls every single hormonal program in your body. It's the quarterback of your hormonal care. They all interact. So when your insulin levels are super low, that pendulum is swinging the wrong direction. And it's happening because you're overloaded with fat and underloaded with sugar demand. So part of what we can help you to figure out is, have you become so what we call glucose sparing? The three words that I'm introduced to you here, because nobody really is talking about it, but we're seeing it in our busy clinical practice. Glucose sparing is where you have sugar that comes from protein from gluconeogenesis that the body's just not using because it doesn't need it. So the sugar's hanging out in your bloodstream and being converted to fat. But because you're sugar spared, you are insulin suppressed. Not insulin resistant, but suppressing insulin. And you see insulin numbers of the 0.5 to 0.8 C-peptide, and you see insulin levels 1.7, 2.5, ridiculously low numbers, almost equivalent to a type 1 diabetic. And no insulin response because it's not necessary. So glucose sparing, insulin suppressed, and usually those people are eating more protein than they actually can use for protein. So the extra protein has to be converted to sugar. And under those circumstances, that extra sugar is just hanging around. So the three words we use: glucose sparing, insulin suppressed, protein resistant. And while we want that pendulum to swing across with a low-carb, high-fat diet, the low-carb, high-fat diet is not an endpoint of a ketogenic diet. We want to swing that pendulum back. And I've got a video out there called Keto Pendulum, but too much fat for too long a period of time is not a good thing. And I know that's going to piss a lot of the keto evangelists off out there, but we have the evidence in my practice of blood work from thousands of patients where we see problems happening when you become glucose spared, insulin suppressed, and protein resistant. And we have to be able to create an insulin trigger again at the time of meals, because insulin's supposed to go up during and slightly after a meal, then it's supposed to go down between meals where glucagon goes up. You want that insulin cycling. And the way to shift that back toward the cycling is to reduce your fat consumption and to increase your glucose demand to create that insulin trigger. Never to the point of insulin resistance. But we're just starting to understand the biochemistry and the evolution of that process. But we know it pretty well right now. So if you are that person who has shifted all the way across, I call them my keto veterans or my carnivore veterans, give us a shout. We can help you to modify this plan and get to the place your body really wants to be. Text us 561-517-0642, WhatsApp, text, phone call, leave a message, we'll get back to you to set up that visit. But too much of a good thing, folks. Too much of a good thing is a bad thing. Too much sugar causes diabetes and obesity. Too much fat may cause that pendulum to go across to be insulin suppressed. You're not going to eat too much protein. What's interesting, Zoe Harcum says your protein level consumptions, your daily protein consumption is very, very steady despite whatever diet you are on, somewhere between 20 and 30%. But it's interesting that protein consumption is fairly highly conserved because the body doesn't store protein. We can talk more about that down the road. We can argue about that or discuss that a little bit more. But protein consumption is pretty highly conserved, according to Zoe Harcum and some of the studies that she's done on this. But fat consumption can go through the roof. Glucose consumption can go through the roof. So we need to understand how those metrics work. And then also, please, folks, minerals, vitamins, trace elements. Too much of a good thing is a bad thing. Too much of a good thing is a bad thing. Get the measurables, get your blood work done, and believe the numbers. Don't believe the hype. I am the Carb Addiction Doc. I hope this resonates.